So we're going to start the assessment now, starting with the cervical assessment, which is the top of the spine, and it controls a lot of the motions, or all of the motions, of the neck. So this is Connor's actual assessment, so you're going to see everything he does right and wrong, starting with the nod. We're looking up as far as we can, and we're looking down as far as we can. When we look up towards the sky, this is cervical extension. And I know it's healthy and operating functionally if I can see a straight line from the shoulder up through the nose, getting about 60 degrees of extension there. Now, when we look down, bringing our face to our chest, this is cervical flexion. And I know it's healthy when I can see the chin touch the chest. That gives us about 45 to 60 degrees of motion, and it's a sign that that motion is healthy. The next one we're doing is we're assessing cervical rotation, and I just like to call this one cross the street because, of course, you look both ways before you cross the street. Now, when it comes to this test, I will know that Connor's cervical rotation is healthy if when he turns his head, his face, the side of his face becomes just about flush with his chest. It won't be perfect, but it'll be just about there. Now, the next move we're doing is called an Indian head bob, and this is going to test Connor's lateral flexion of the cervical spine. When we do this, I'm looking for about 45 degrees in either direction. Can be a little bit more, can be... Okay, friends, let's take a look at assessments for the lumbar and thoracic spine next. So this here is testing Connor's extension, and we call this move the Neo, because if you've seen The Matrix, Neo does just bullets like this because he is indeed the chosen one. Now, when you do this one, what we're looking for is for Connor's chest to become about parallel with the ceiling. So you can see here that he's pretty flat. I could basically eat off of that chest, and he is parallel with the ceiling when he does that. So this is a pass for this test here. Now, this is a move called the twist, and it tests Connor's rotation. When we test the rotation, what I'm looking for is that Connor can get his chest flush with me when he turns. So I should be able to see the full chest when he turns in either direction if Connor is going to pass this test here. Now here we have a test called the bend, which is going to test Connor's lateral flexion or just his ability to move to the side. And when we do this, what I'm looking for is that his hand gets past his knee. You'll notice the hip shoots out to the side a little bit as Connor drops down. That's normal. But as we're doing this, we want each side to get past that knee. Alright, now this move here we're going to use to test flexion. This is a move called the roll back. And it's kind of like getting stacked in jiu-jitsu, if you've ever done that. But what I'm going to do is bring my legs back until I can see the feet touch the floor with my legs squeezed together. That's the first thing I'm looking for, so no opening up those feet. Next thing I'm going to do is go forward, and I have to touch my toes while keeping my back as straight as possible. So you see here, I'm not really rounding at the back. I'm touching those toes, and then I just keep repeating the exercise back and forth. It's actually a fantastic stretch. And touch. Now this move here I use to really isolate what the thoracic can do. The thoracic is much more mobile than the lumbar spine. All the other exercises had elements of both, but this really lets me isolate just the thoracic. So when you do this one, you just want to turn from the upper back. Really try not to turn the lower back at all if you can help it. And what you're looking for is about 80 degrees of motion. So you'll see on Connor's right side here, this is correct. This is great. And we're going to take a look at the left side now. Connor will not be able to turn as much on the left side as you can see here. So Connor's getting about 70 degrees of motion here. We have an unsymmetrical balance, and that's something that we'll need to work on.